inspire the 11th and 11th and 12th students such as Shreya coaching classes, Maui classes, and sir also having the Scholars Academic Institute at Alnad has provided the free education to the poor students, and sir is also worked in another institute, that is Yashraj classes as to coach the 11th and 12th students. With this brief, once again I welcome you, sir. Now I request Dr. Ankita ma'am to present the booking.
Sir, can you reply setting mic? Too loud. Thank you. लागत है ओके ठीक. So thank you so much for nice introduction, and thank you so much for KLE College of Pharmacy as well as the organizer and principal sir Dr. Swami, then Arya madam, and even Sagar also. So he is in contact with me since yesterday. So thank you so much all for giving me this opportunity. And today I am going to tell you about and simultaneously the narrating the details about the molecular docking actual experimentation. Okay, so I hope you all are waiting for all these things, as many of the speaker are talking about the introductory part about the molecular docking, but what actually molecular docking is very different. Okay, the molecular docking is started with a means it is related to the protein, then drug molecule, and these things how they correlate with each other and everything that I am going to tell you. Okay, so I'm giving some short introductory part. I'm taking some short introductory part related to the molecular docking, which is not taken by all the speakers. As yesterday, I have just log into your YouTube channel. Uh, I have seen the lecture which is given by one IITian, and today morning also sir has given some basic introductory part related to the molecular docking as well as the simulation also. Okay, but actual molecular docking is what it is and what expectation you are uh, uh, considering about a molecular docking, that I want to know to frame this hands-on training. Okay, so what type of questions are running in your mind, that I want to know first. Okay, can you tell me what you are expecting from me to go into the, how much go into the deep into the molecular docking? Anybody from you have done molecular docking till that? Okay, then any queries? What are the queries running in your mind related to the molecular docking? Yes, protein related again. So that is the start. protein selection is a very first step, and if that is a wrong, then whole docking is wrong. Okay, again. Okay, uniprot id again. Okay, that is a grid pocket. How to select the grid again? So that I will cover again. Let me know the expectation. So I can frame this hands-on again. So if you are means actually I came with the big data analysis, then virtual screening, but one of my friend that was called for this workshop, but he unnecessary. I think unexpected reasons they have come, and he is not coming. So actually, he was taking about the single molecular docking, and I'm going to take about the virtual screening. Okay, so these two parts are very different. Single molecular docking is very easy, but how to handle the big database and how to do the actual virtual screening, that is a very actually completely different. Okay, so is there any? I think I should start with the uh, one protein with the one molecule. Then after that, if the time remain, then I will go for the virtual screening. Okay, so I think it is connected to the another PC. Hmm. Okay. Yes. So if you know, I'm taking just basic, like what is the difference between the traditional approach and the computer aided approach? It is some like the difference is the same. It is blind approach, and that is a completely a targeted approach. Means you will get the definite destination uh, as far. Okay, and here there are many different techniques we are using, by which we are not supposed to go at the destination. Means there are near about 99% chances are there that you will get the your destination. Here only 1% chance is there you can reach to your destination. Okay, so similar to that, the computer aided drug design gives you the direction how to design the drug, how to how do the drug is attached with your target molecule, means protein, and how you will get the result. Okay, so that you will get at the first outset by sitting onto the one chair. Okay, and this is the general diagram for drug discovery, you know very well, but I want to mention that if you want to uh, decrease this time, 15 to 20 years time is required for drug development process from start of a research. Okay, there are total four phases are there, means basic research, drug discovery and development, and post marketing. So these two are actual practical here we need to do the actual experimentation, but here in this first part, if we apply the computer aided drug design process, then we can reduce this time. Actually, this the time is near about 6 to 7 years, that we can reduce to the 6 to 7 months only. Okay, by means even manpower is a less required. Okay, only one man can do all these things. Okay, by sitting on one lab, on one chair, on one table, and by using only one computer, you are you can complete this research in only 5 to 6 months. Okay, uh, where to apply this? So these are the different computer aided techniques. Why I'm telling you? Because all these techniques are coming at the end to the molecular docking. So that's why you should be aware about all these things. Means in the CAD, this is the overall CAD strategy where computer design technique which is applied to market any drug molecule. Okay, to invent any drug molecule. So here for target identification, target validation, lead discovery, lead optimization, and preclinical test. So all these techniques we can use in silico. Okay, so in silico techniques we can apply that for these different parameters. They are this one. Okay, structure based and ligand based drug discovery techniques are there. Okay, then uh, so this is about the virtual screening or any drug molecule. If you want to find the particular drug for the particular target, then this is the base diagram that can gives you idea about how your drug molecule can fit into one lock, one receptor. Okay, so at the center there is a receptor, and this is the database. Actually it is not a key, these are the databases. Okay, so there are many databases are available, and from already there are many compounds are already synthesized and which are available on the different databases. But if you want to choose the perfect one, or sometimes if you go for synthesis and everything, see already the compounds are there. Okay, there is a no need to do extra synthesis and their biological activity and all these things. There is a no need. Already there is a many databases are present where actual drug synthesis done by the different industries. Okay, so what you can do, you have to choose any particular drug from that database, and you can go with this on the basis of a virtual screening. Okay, so before going to molecular docking, I just wanted to tell you about the awareness about the protein molecule. Different types of receptors are there, and which are they? So before going to types, you should be aware about the structure of protein. Okay, so what is the structure of protein? You already studied. I think all are pharmacists, and they already know about this in the biochemistry. Okay, can you tell me which are the different parts present in the protein? Already it is given: primary, secondary, tertiary, quaternary. Okay, but here I want to mention that which part is a flexible and which part is a rigid. Okay, that is the very important key things that you should consider during the docking as well as the simulation. Okay, so in the primary structure is a linear one, it is a state chain. Secondary structure is a, there are two types of a secondary structure which are rigid one. Okay, the primary structure is a flexible, which is nothing but a loops, which are called as a loops. So protein has a backbone which is mandated by the secondary structure. So that is alpha helix and beta sheets. So alpha helix and beta sheets are rigid in the protein, that do not get flexible. Okay, and the primary structure, that is a loop region which is there. So loop region can be flexible. Okay, it can be, it can see some receptors are there. After binding of a ligand, there is opening of that loop, there is a closing of that loop. Okay, that is happening in the protein structure. Okay, so if any drug molecule is getting bind to the receptor, and if it is changing your secondary structure, so that type of a drug is not suitable for your docking. Okay, that we get to know from simulation. Okay, so these things you have to keep in mind. Okay, so that we are getting from RMSF, root mean square fluctuation, that is we are getting from RMSF, molecular dynamics. Okay, so from that we are getting this. So before going to molecular docking, you should be aware about the structure of a protein. So these two things you have to keep in mind. There is a alpha helix, beta sheets, and loop region which are flexible. Alpha helix and beta sheets are not flexible. Okay, so whatever the binding pocket is should be there. That binding pocket also contains the loop regions. Getting? Huh? Then, so these are the different types of a protein that we can target for our desired study, biological action, whatever biological study you are going to do. So these are different targets, and on the basis of that you can search the target on the protein sites. Okay, so PDB will be based upon all this. Okay, so there is a hormone is there, then these are the blood protein, then structure of protein, enzyme, storage protein, membrane protein. So all these protein structure information you should have before going to do the docking study. Okay, so what type of a protein should be, what type of a study you are doing. See, for example, if you are doing the anti-cancer study, so in that case you should be target on enzyme, kinase, okay, like that. So such type of a study you have to do first. You have to read all the articles related to your biological activities. You should determine which particular target is responsible for that particular activity. Okay, sometimes activities has a wide scope, means for example anti-diabetic activity or anti-inflammatory activity, so it has a wide scope. There may be a chances of a different types of a target. There may be a prostaglandin, there may be cytokines, different. There are many cytokinins are coming in the pathway of a anti-inflammatory action, sorry, inflammation. So that's why which particular cytokinin you are targeting, that matters a lot. Okay, so you have to study first the your target. Okay, then I'm not going to discuss about it. Okay, so what is this? See, here I want to mention about the protein structure, how the protein structure came, and how we can choose, and why we are choosing that. Okay, see, at the first outset you can see that there is a protein structure is there, there is some helical and beta plated sheets are there. So that is coming from actual body of organism. Okay, so for example, if you are doing the anti-cancer activity, so you should select the organism as a homo sapien. You are not going to decide the drug for anti-cancer action of a mice or rat, or it should be homo sapien. Okay, so homo sapien is a, see, anti-cancer activity we are doing for us, not for animals. Okay, so you have to consider the organism first for selection of a protein. Okay, so how this protein come, what the researcher do, they are isolate, they are actually first they are inducing the disease into particular organism. After that, giving the particular drug which is responsible for its minimization of that particular action, and then they isolate the drug from isolate the target from that site, and just keep into the path of X-ray crystallography. Then what the X-ray crystallography do? X-ray crystallography can identify the XYZ coordinate of each and every element present in that protein structure. Protein is made up of carbon, hydrogen, oxygen, again sulfur, phosphorus. Okay, such type of elements, regular elements with that we are teaching and learning in the chemistry. Okay, regular elements are there, but it has a bigger weight, bigger molecular weight. Molecular weight may be more than 2 lakh. Okay, it should not be less than 500. It is, the protein structure has a molecular weight more than 2 lakh to 4 lakh. So what the X-ray crystallography do? They can identify the each and every element present in that protein, and simultaneously its XYZ coordinate. So what is that XYZ coordinate? It can identify the molecule or any atom from 3 dimensions. So that's why, what is its X direction, what is its Y direction, what is its Z direction. See, for example, the person is sitting there. Okay, so its location is 5 meter from this, 2 meter from this location. Then means XYZ coordinate for that particular atom or particular molecule, that can be identified by the X-ray crystallography, and that can be coded into one text file. The PDB file is nothing but a text file. You can open it into the notepad. Okay, so everybody has a notepad. Okay, so every type of a chemical file format is made in the text file. It is a text, simple text file, only extension is a different, only the file information is a different. But all, if you don't have any type of a tool which is used for particular for reading the any chemical file format, then just right click that file and open into the notepad. You will get a whole information. Okay, so I will take that, but before that you just consider the fundamental behind how the protein comes. Okay, then the researcher uh, mention each and every xyz coordinate of each and every element present in that protein, as well as see simultaneously what they do, they have given the drug molecule to the organism, so its xyz coordinates also coming into that protein. So that's why we are getting to know that at which particular site drug is binding in that target that for that particular action. Okay, so that site we can identify. Getting what are the researcher doing? They are inducing disease. They are giving drug. After that, isolating that particular target from the body and keeping into the path of X-ray crystallography. And then just coding that information into the text file and giving the extension as a PDB. Getting? Everybody getting? So every element, whatever the element present in that, so all element we have to, they are mentioning into that PDB file. But what is the drawback of this X-ray crystallography? It does not identify the minute uh, element, minor element like hydrogen. So hydrogen has a molecular weight 1. So that type of a molecule, atoms can't be identified by the X-ray crystallography, which is very mandate. It is very important. Hydrogen is very important for determining the stereochemistry, determining the steric hindrance. Okay, because the molecular weight is a bigger one, so that's why each and every hydrogen is matters a lot. So for that reason, whenever we are going for docking study, we should add hydrogen first, and after that we should give the minimization. Get it? X-ray crystallography does not identify hydrogen, so that's why we are adding that. But if there is a no any X-ray crystallographic structure is available on the database, then in that case, right now there are X-ray means well-resolved system is there, that is a electron microscopy that can identify hydrogen. So in that case, you should not add the hydrogen. If you add hydrogen, then your system get unbalanced, your protein get unbalanced. Okay, so just keep in mind that even NMR is also, NMR is only for hydrogen prediction. It is for proton prediction. So if proton predicted structure is there, then you can use that. But in that case, you should not add hydrogen in the protein during the minimization. Getting? So these are the key things which are responsible. So simultaneously see here. So that protein is used for structure based and ligand based approach. But for every type of drug discovery, there is a need of molecular docking. If you master in the docking, you can learn any computer aided drug design technique. Okay, so that is very mandatory. So at the start, at the end, you can start with the molecular docking. Every technique. So it is mandatory. Okay, so if you want to learn the computer aided drug design, first start with molecular docking. That is very important. Okay, if you are aware about it, you can do anything. And simultaneously, it is see, it can be applicable in the all branches of pharmacy. For example, see, here there is only protein and ligand is there. I am talking about protein and ligand. So you can say that it can be applicable for pharmacology and pharmaceutical chemistry. Not only that, you can apply it for pharmaceutics also, for determining the co-crystal information. Means, for example, they are using a co-crystal for solubility studies. Okay, so in that case, you can do the docking of a molecule, and then after that you can determine the solubility study of that particular molecule also. Then in pharmacology, there is a big database of a natural product. Okay, so you can take that, you can do the directly virtual screening, and you can get which particular phytoconstituent is responsible for that particular activity, and which particular target that particular extract is acting, that you will get to know. Okay, so if you get to know about these things, you can definitely do get a idea in a second. Okay, if you master in molecular docking, you will get, see, till 2022 I don't have any publication, no any publication. I was in administration, so that's why I don't have any publication till that time. But after that, actually I started learning in 2013. Okay, but after the molecular docking, I started learning on molecular dynamics also. So from 2022, I started my publications, and right now till date I have 33 publication with a cumulative impact factor 125. Only 33 publications. So that is a logic, that is a magic of molecular docking and dynamics. If you are aware about it, then you can get a many ideas. You can start with a new research every minute. Okay. I'm not taking this. Already, you already, I think, saturated by all this. So this is a basic protocol for molecular docking. First, there is a target selection, there is a ligand selection, target preparation, ligand preparation, then actual docking, then evaluation of a molecular docking result. These four slides are very important. Okay. So whenever you are considering any target for particular study, you should be consider these 6 points. There are many, but they are coming under these 6 points. The first is a drugability, then selectivity, then existing ligands, then assay availability, then structural information, then biological relevance. So what is that actually? See, for example, if you are considering the any particular target, okay, and you have a drug, already you have a drug, it has a bigger size. So for example, if you are going for anti-inflammatory action, okay, so anti-inflammatory drug, there are two types. Okay, one is a means the majorly which are available in the market, cox1 inhibitor, cox2 inhibitor. Okay, so cox1 has a smaller structure, if you notice, and cox2 has a bigger size, a bigger uh, size molecules, okay, which are not available in the market right now. They are all callback from the market. The reason is because of heart congestion. Okay. Anybody knows about it? Box 2 is not available in the market right now. Okay, because see, their specific action is that if you see the mechanism, mechanically, if you see, the COX1 has a smaller pocket and COX2 has a bigger pocket. Okay, so if the bigger size molecule is there, then definitely it will not go into the pocket of COX1, but it can go into the COX2. Okay, so this is the fundamental, or this is the way they have designed their molecule. Okay, so that is the drugability. Okay, so drugability means what? Your first thing you have to consider that whenever you are choosing the target, your drug pocket should be in the deep into the protein structure. It should not be on the surface. If it is binding to the surface, definitely your drug should not get written onto the that particular surface. Okay, because every object has a particular strain, so that's why it will get removed from that position. So that's why you are not getting a proper action for that drug. Okay, so whenever you are selecting the protein structure, just check that its pocket is deep into the site. Okay, if it is deep, definitely you will get a very good result whenever you are going for the biological activity. Okay, then second is selectivity. Selectivity means what? There should be complementary sites for the drug molecule. Okay, that is a selectivity. Again, existing ligand. So if the protein is already available with the inhibitor, then you can site your molecule easily onto that. Means you will get a grid parameter easily. If it is not there, then you have to select whole protein, and because of that the background calculation for the molecular docking get increases. Getting? Okay. Simultaneously, the protein structure is a bigger one. Okay, it has a many binding pockets, many pockets. But sometimes what happen, the drug, see, we are not taking a proper drug for that. We are checking that either my drug is binding to that particular target or not. Okay, so sometimes what happen, if the drug is not selective, still it can goes into the another pocket of a protein, and so that it can give, it can, so you will get misunderstand about your drug molecule, that your drug is binding to the another target rather than the actual binding site. Okay, so you should be, uh, you should select the such a protein which has already ligand there, existing ligand is should be there, means it is called as a co-crystal ligand. Okay, then next is the assay availability. See, you are doing the any particular, means you have synthesized some compounds, and if you are going for uh, biological activity of that molecules. Okay, so if you are doing any particular assay, so for that particular assay, that study is done or not, you have to check first. Okay, getting? So that assay, if that assay is available and its activity is given, then you have to choose that protein. Okay, means activity should not be different, means that assay should not be different from the selected protein. Okay, so that thing you have to consider. The structural information and biological relevances, again I want to mention here that, see, the protein should be, protein, um, say anti-cancer drug delivery, anti-cancer, if you are designing the anti-cancer drug, so most of people, 90% people are doing the anti-cancer studies. So there should be a acidic environment in the cancerous growth. Okay, so wherever there is a, cancer is generating, there is acidic environment. So if your drug is a neutral in the nature, or if your drug is getting degraded into the acidic environment, so drug or protein, okay, then such type of things you should not be considered. So whenever you are doing the molecular docking, whenever you are selecting that protein, then during preparation you have to choose the pH which is matching with the actual cancer target. Okay, means it is given in the literature that whenever such type of a condition happen, breast cancer it is there, so the pH should be 6.4, 6.7. Okay, such things are given in the literature. So you have to minimize your protein at the pH of 6.4, so that the protein will get good result which can be matched with your biological result. Get it? Okay, so these things you have to consider. Then selection of ligand, how the ligand is selected. The first thing is that we have to start from similarity to the known binder. See, for example, already protein is available and its co-crystal ligand is available. So what if it contains the pyridine ring? So what you can do, you have to select the such a derivative which contains the pyridine, if you have a chance to choose the molecule. Otherwise, if you have already pyridine containing synthesized compound, so you have to choose the such type of a compounds which are available into the protein. So see, on the database there is a large number of proteins are available for one target. If you see, in the 2020 there was only one protein was available for the SARS-CoV main protease, 6LU7, and that is also not actual derived. It was designed, okay, by AlphaFold. But right now if we search for that, there are many proteins are available. Okay, so such type of things are there. So you have to choose the search of protein. All protein have a same sequence. Okay, if it is, if see, for example, mind body COX2 is there, and his COX2 is there, so sequence is same. Sequence is same, only the difference is that sometimes what happened, the diet matters. Okay, some essential amino acid that cannot be consumed by me and consumed by him. Okay, so in that case, the some amino acid protein should, see, RNA does not stop at that condition. It can miss that amino acid and start preparing the protein. Okay, so that amino acid can be missed in your protein. Okay, so wherever you are searching for the protein, again you have to consider which amino acid are missing from that. So it is given in the protein also. Whenever you are downloading that PDF file, just open into the text pad, you will get the and search for missing. So you will get to know about the missing residue information. Okay, so similarity with the known binder already available compound you should take. Okay, then drug likeness, you should apply the rule of 5 first. Okay, because 95% drugs can be uh, can have the properties which are under this rule of 5. Only 5% drugs are there that doesn't have the active that have a activity, but they are not following the rule of 5. So that's why first you should screen the drug likeness. Okay, so we should go with the majority. Okay, then ADME toxicity prediction. So first you should go for pharmacokinetic pharmacodynamic properties. See, for example, you know very well cytochrome P450. Everybody knows there are 5, 6, 7 types of cytochromes which are responsible for the metabolism of a different types of drugs. Okay, so if antipsychotic drugs are there, if you are taking two antipsychotic drugs at a time, then the second has a more concentration in the blood than that the first one. Okay, the reason is that the cytochrome P450 can metabolize the first one, and the second should not be attached to that cytochrome, so that's why it can get into the bloodstream and its concentration get increases. So such type of things you have to consider during the combination therapy. Get it? Whenever you are using the, say for example, anti-cancer means chemotherapy is there. So in chemotherapy, such type of things are considered. Even if you are taking the anti-cancer drug, means designing the anti-cancer drug, so you have to consider which particular another drug which is marketed available can be utilized for chemotherapy. Okay, means first the drug you should give, and after that the design drug should give, so that the second drug concentration increases in the blood. Okay, so such type of information we are getting from this ADMET. So you have to first of all start with the ligand properties first, means you should screen. Okay, there is a one site, whenever you are going for this ADMET determination, Swiss ADME, then pass online. So pass online gives you the target also. Okay, so even Swiss have that target prediction. Okay, but which the better one is a this one, pass online. Okay, it is depending upon the QSAR. Okay, again for prediction of this ADMET toxicity study, there is a Protox server is there, and another better tool is uh, PKCSM. The PKCSM gives you the very good result as compared to the other tools. As I am using the PKCSM every time, so it matches with the activity also. Okay, so there are many papers also which gives you idea about the matching of these result with the actual experimentation. Okay, then next is the availability. Availability means what? See, you have synthesized, design 100 molecule, and they have very good score. But many times what happen? There is a no possibility of that compound to synthesize. Okay, so in that case, you should go with the synthetic accessibility score, which is given by the Swiss ADME. Swiss ADME gives you synthetic accessibility score. If the score is greater than 6, the compound should not be get synthesized. If it is less than 6, you can synthesize that compound. The lesser the number, greater the chances to synthesize. Okay, so even uh, simulation plus ADMET predictor, that also gives you this synthetic accessibility score. Okay, so you should screen all these things before going to the actual docking. because everything you should give, means see, first, if because docking is taking time, so after docking, if you are doing this, then it doesn't have any use. Okay. Then chemical space, volume of pocket. If your molecule is bigger and the pocket is small, the drug should not get enter. You will get a positive binding energy for that particular molecule. See, keep in mind that whenever you are getting a positive binding energy, it means that your volume of pocket is a small. Okay, and that you will get to know from the meta pocket. There is a one server that can gives you about the volume pocket information. So you can, what you can do, you have to check the volume of a molecule on MoleSoft. MoleSoft is the tool which gives you the volume information of a drug molecule, and the meta pocket gives you the volume meta pocket. Then CASP is another server that gives you the, sorry, volume of your binding pocket. Okay, so from that you will get to know that which particular drug is fit properly into the binding site. Okay, all these things you have to consider whenever you are going for the ligand selection. Okay, and similarity to the known binders means already available compounds. Then protein preparation. So for protein preparation, there are 7 steps are there. First is a structural source, its resolution, RM plot, then WWW PDB validation score, and these 3 things you have to consider. I think yesterday that sir has given about the RM plot, Ramchandran plot. Okay, given information related to the Ramchandran plot. Then resolution should be below 2. If it is what you can say, cryo-EM, electron microscopy structure it is there, then it should have a resolution below 4. Keep in mind, because right now whatever the proteins are coming, they are electron microscope, resolved by the electron microscope. So that's why you can choose the protein which having resolution lesser than 4. Okay. Then uh, cleaning the protein. So here you can clean the non-standard ligands which are present in your protein. So here those who already done the docking, so many times they are getting idea about, so many times they get confused about which particular ligand we should keep and which ligand we should remove. Okay, so here I want to mention that you should be aware about which are non-standard residues present in your protein and which is a standard residue. Standard residue means what? Amino acid. Non-standard means other than this, all are non-standard. But sometimes what happen, for the isolation of that particular protein, the researcher added some glycols, then sulfates, okay, to stabilize that protein, okay, to stable that protein so that the protein get good result. Okay, so sometimes they are present in the binding pocket also. Okay, even water molecule are also present over there. So all these things you have to remove. Okay, then the adding hydrogen here, I already told you that cancer, then even inflammation also. Inflammation, if there is inflammation, in even inflammation also there is a hydrogen. You have to add the acidic hydrogen. Okay, so that type of things you have to consider. Then missing residue and atoms. How to add missing residue? Missing atom you can add, but missing residue, there are very less tools are available which can add the missing residues. Okay, so one of them is a chimera. Chimera. Okay, so chimera is a one of the tool which can use for addition of a missing tool. Then second is that but when we can add the missing residue, so this you should learn properly. Missing residue, if that missing residue is present in the binding pocket, then you have to add. If it present far away from the binding site, there is a no need to add. Do not um, means lose your efforts on adding that missing residue which are far away from the binding site. Okay, just keep in mind. Okay, so first check the binding site. and if they are if they are related to the binding site, then you have to add them. If it is not, just keep it as it is and you just start with. But whenever the researcher adding that protein, then the binding site is properly resolved. So that's why there is a no such a protein I got till date which having the missing residue in the binding pocket. So do not uh, run behind addition of a missing residue. Okay, because uh, the method is a very tedious. The homology modeling, I think you'll heard about it, homology modeling. Okay, the homology modeling is one of the technique that which can take the sequence of a protein, and on that basis that design the molecule, that on that basis they design the protein structure, and they minimize it, and then that protein we can use for the further docking. Okay, so same like that for missing residue, we just check the which protein having that missing residues, and that sequence we just add into that protein, and newer protein we design, then again the process get long. Okay, so that's why I strictly recommend that do not run behind addition of a missing residue, as already they are available. Every residue which is belongs to the binding site, they are present in the binding pocket. Okay, because it is that type of a care are taken by the researcher. Then charges and energy minimization. So this is very important. Actually everything is important. I'm calling everything, everybody as a this is important, but everything is important because it is a protocol. If you go with all these things, then and then your docking should be perfect. Otherwise, there are many things are there that you can lose your result. Do not you will not get the matches with the actual biological activity. Okay, so the charges. So there are many types of a force field are used to minimize your protein. Okay, charges means what? The positive, negative charges, and another thing is that the for the minimization of that protein, we are using applying the force field. That is also called as the charges. Okay, the force field are different. In that, the first one is that molecular mechanics force field, and the other is a quantum mechanics force field. So molecular mechanics force field is a such a force field which can give us calculation within a second. Means, for example, I will ask 25 multiplied by 25. How much? Yes, 625. Okay, but our mind is not prepared. Okay, we are giving the approximation that might be it 550, 575, 625. Okay, so these are approximation. Okay, the molecular mechanics, what they do the calculation approximately. Okay, and quantum mechanics, they are doing actual calculation. So that's why they are taking time. Okay, so for one molecule, minimization of a one molecule, it takes near about 3 to 4 days. This, for example, if you want to minimize the aniline, it will take 2 days. Aniline, it has a molecular weight near about 120. Okay, but the protein structure is a bigger one. So for that purpose, we have to use the molecular mechanics force field. Okay, and the minimization of the ligand, we have to use the quantum mechanics force field, so that you will get a proper result. Okay, if you minimize your molecule using the quantum mechanics force field, quantum mechanics means, have you heard about DFT, density functional theory?